The lower limb consists of the pelvic girdle, the femur, the tibia and fibula, the tarsal bones, the metatarsals, and the phalanges or the toes. The pelvic girdle attaches to the lower limbs and consists of two coxal bones. The bones of the pelvic girdle are more massive than those of the pectoral girdle, mostly because they have to withstand the stresses involved in weight bearing and locomotion. Each hip bone is formed by the fusion of three bones: an ilium, which we see here in purple, an ischium, which we see here in yellow, and a pubis, which we see here in pink. The ilium, ischium, and pubis meet inside the acetabulum, which is a concave socket that articulates with the head of the femur. Each of the three bones make up a third of the acetabulum. This is an anterior view of the pelvis. The ilium provides extensive areas for the attachment of muscles, tendons, and ligaments. The iliac crest is the ridge along the superior portion of the ilium and marks the attachment site for ligaments and muscles. The shallow depression on the anterior surface of the ilium is called the iliac fossa. This concave surface helps support the abdominal organs and provides additional area for muscle attachment. The greater sciatic notch is an indentation where the sciatic nerve passes by to reach the lower limbs. We see here that the right and left pubis bones articulate at a joint called the pubic symphysis that is separated by a pad of fibrocartilage. Here we see a posterior view. On the ischium, the ischial tuberosity is a roughened projection that's located at the posterior and lateral edge of the ischium. When you are seated, you are sitting on your ischial tuberosities. Here we see a comparison between the male and female pelvis. The shape of the female pelvis is different from that of a male. Females have much smoother and lighter bones with less prominent markings. Females have other skeletal adaptations for childbearing, which include an enlarged pelvic outlet, a broader pubic angle, greater than 100 degrees, less curvature of the sacrum and coccyx, and a broad pelvis that doesn't extend as far superior. Typically, the female iliac crest will rest at the height of L5-S1, whereas the male iliac crest will rest at the level of L4-5. These adaptations help support the weight of the developing fetus within the uterus as well as the passage of the newborn through the pelvic outlet during delivery. In addition, the hormone called relaxin is produced during pregnancy and loosens the pubic symphysis and the sacroiliac ligaments, allowing movement between the hip bones that can further increase the size of the pelvic outlet. In the lower limb, the skeleton consists of a femur or thigh bone, a patella or kneecap, a tibia and a fibula or leg, and the tarsal bones, metatarsal bones, and phalanges of the foot. The term leg refers only to the distal limb, and thigh refers to the proximal limb. This is an anterior view of the femur. The femur is the longest and heaviest bone in the body. It articulates with the hip bone at the hip joint and with the tibia of the leg at the knee joint. The rounded epiphysis is called the femoral head, and it articulates with the pelvis at the acetabulum. A ligament attaches the acetabulum to the femur at the fovea capitis, which is a small pit in the center of the femoral head. The neck of the femur has an angle of about 125 degrees to the shaft. The greater trochanter is a large projection that projects laterally at the inferior aspect of the neck. The lesser trochanter is a smaller projection off the medial neck. Here is a posterior view of the femur. The gluteal tuberosity is a smaller, rough projection on the posterior surface of the femur that is lateral to the lesser trochanter and inferior to the greater trochanter. It's the site of attachment for the gluteus muscle. As the shaft of the femur approaches the knee joint, it widens into the medial and lateral epicondyles. These smooth, round projections form the medial and lateral condyles. Looking at the condyles on the anterior surface, we see the patellar surface, which is a smooth articular surface on the anterior side between the two condyles. The patella is a large sesamoid bone that forms within the tendon of the Quadriceps femoris. The Quadriceps femoris is a group of muscles that extend or straighten the knee and are found on the anterior thigh. Here we see an inferior view of the right femur and the patella. and the patella would glide superior and inferior on the femur. Runner's knee or patellofemoral stress syndrome develops from improper tracking of the patella across the patellar surface, which results in swelling and tenderness after exercise. This is an anterior view of the tibia. The tibia or shin bone is the large medial bone of the leg. The medial and lateral tibial condyles articulate with the medial and lateral condyles of the femur. The tibial tuberosity is a prominent rough projection on the anterior surface of the tibia just distal to the condyles. This is the area of tenderness that is found in the disorder Osgood-Schlatters disease. At the ankle joint, the tibia widens and ends at the medial malleolus on the medial side. The medial malleolus is the medial or inside bump on your ankle. The inferior surface of the tibia articulates with the talus, which is the proximal bone of the ankle. The medial malleolus helps to support this ankle joint. The fibula parallels the tibia and is found on the lateral side of the leg. The head of the fibula is proximal and it articulates with the tibia. Near the ankle, the fibula ends distally in a projection called the lateral malleolus, or the bump you feel on the lateral aspect of your ankle. The lateral malleolus also provides stability to the ankle. However, a forceful movement of the foot outward and backward can dislocate the ankle, breaking both the lateral malleolus of the fibula and the medial malleolus of the tibia. This injury is called a Pott's fracture. The ankle or tarsus consists of 7 tarsal bones. The talus is the large bone that articulates with the tibia. The talus transmits the weight of the body from the tibia toward the toes. The calcaneus or heel bone is the largest of the tarsal bones. When you stand normally, most of your weight is transmitted from the tibia to the talus, to the calcaneus, and finally to the ground. The Achilles tendon is the calcaneal tendon, which arises at the calf muscles. These muscles can lift the heel off the ground so you can stand on your tiptoes. There are 5 other smaller tarsal bones that articulate with the talus proximally and with the metatarsals distally. The metatarsal bones are 5 long bones that form the distal portion of the foot. These bones are identified by Roman numerals 1 through 5. Proceeding from the medial side to the lateral side. Distally, each metatarsal bone articulates with a different proximal phalanx. The phalanges or toe bones contain 14 phalanges just like the fingers. The great toe is called the hallux and has 2 phalanges, proximal and distal. The other 4 toes have 3 phalanges apiece, proximal, middle, and distal. Running places more stress on the foot than walking. Stress fractures are hairline fractures that develop in bones subjected to the repeated shocks or impacts and usually involve one of the metatarsal bones. Ligaments and tendons maintain the arches of the foot by tying the calcaneus to the distal portion of the metatarsal bones. The medial arch is much more pronounced than the lateral arch. If the normal arches are lost or have fallen or have never formed, this condition is called flat feet. The movement at the ankle when you rest all your body weight on the calcaneus and dig your heels in is called dorsiflexion. Oppositely, when you stand on your tiptoes, your weight rests on the metatarsal bones and the phalanges, and this is called plantar flexion.